Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this video, Dr. Pooja Singhal, a board-certified gastroenterologist, talks about abdominal bloating. She is interviewed by Dr. Anu Bajaj, a board-certified plastic surgeon.
Good morning, everyone. I'm Dr. Anu Bajaj, and I'm here today with my close friend and colleague, Dr. Pooja Singhal, who is a gastroenterologist in the Oklahoma City area and recently opened her own practice. She is a board-certified gastroenterologist and has actually been in practice for almost 8 years. And so we're excited to have her today.
Thank you, Dr. Bajaj. I'm thrilled to be here.
So today, Dr. Singhal and I are going to talk about a very common problem for all of us, and that is abdominal bloating. So let's start with it. Dr. Singhal, what is abdominal bloating?
Yes, this is a very, very common topic that I get questions all day long. Abdominal bloating refers to the sense of fullness and tightness in the belly. And abdominal bloating is a subjective feeling. The terms abdominal bloating and distension are often used interchangeably. Abdominal distension means visible distension or measurable distension in abdominal girth. So when you feel the stomach actually increase, like I'll have several patients come to me who have taken pictures and they would say, look, I look 9 months pregnant and I'm bloated. That's the actual distension. The bloating does not have to be actual visible distension, but the feeling of fullness and tightness.
So how common is this? I mean, I see a lot of my patients who come in and who complain about it, and so I want to know.
Great question. Yes, it is actually very common. It's estimated that 15 to 30% of U.S. population suffers with abdominal bloating. And it's prevalent. It's important to note that it is very prevalent in both men and women, and more commonly in women. And there are different types of bloating. There are different conditions that can lead to bloating, especially post-surgical as well.
So why is it more common in women?
Yes, great question. Well, it's more common in women because, we have an extra organ, uterus, and we have different states that we go through: menstruation, menopause, pregnancy. Our hormonal regulation, pathophysiologically, is very different from men. So there's definitely contributing factors and different disease states that affect women that do not affect men. So that's why it's more common in women.
What are some of the causes of bloating? Other causes?
Yes. I love to talk about this. So the most common, cause, of course, that when you think about abdominal fullness, everybody thinks that I have a GI problem. There's something wrong with my stomach, colon. So some of the GI conditions that can cause abdominal bloating include conditions that lead to slow transit in the GI tract. So constipation. So if you're not passing stool regularly or appropriately, you're going to have backup of gas, leading to that sensation of fullness and tightness. Irritable bowel syndrome. Almost 90 to 95% of patients who suffer from irritable bowel syndrome can experience bloating and often do. Celiac disease, which is gluten maldigestion, can lead to increased intestinal gas and feeling of fullness and bloating. Similarly, gastroparesis, which is decreased motility of the stomach, can lead to delayed food emptying into the small bowel, and again, more delay in expelling of the gases that can lead to bloating. And then there are other GI causes like history of eating disorders, small bowel dysmotility. So these are just the GI causes that can lead to bloating. There are other causes, like I kind of alluded to earlier. Let's talk about the ones that affect women only which are gynecological causes. So menstruation, menstrual cycle, hormonal changes, endometriosis, all of those conditions can lead to feeling of swelling, fullness, tightness. And then there's, of course, the post-surgical bloating that you kind of referred to, that a lot of people that you see complain of bloating.
Yeah, I mean, with my patients, a lot of what I see commonly is if I see a patient who's coming in for a tummy tuck or an abdominoplasty, I find that a lot of my patients have issues with chronic constipation, and that gives them this sense of feeling bloated. And they have this before surgery, and I want to make sure that after surgery, it's not an issue because it can affect the results of their tummy tuck if they have a lot of bloating or they need to strain a lot. So what are some things that we can do to minimize that or prevent it?
Absolutely. And thank you for bringing that up. It is so important to have regular bowel regimen. And there is no standard regular bowel regimen for good gut health, good anorectal health. The normal bowel regimen can vary from individual to individual, but the sense of complete evacuation is the key. The sense of not feeling bloated is the key. So constipation is usually defined by, we look at 3 different factors. We look at number of bowel movements. We look at the stool caliber and straining, and then we look at if you're having the feeling of complete evacuation. And what are the things that we can do to have good bowel regimen? Well, physical activity is a big, big one. Movement, good nutrition, and high fiber diet is another key point I want to stress. Unfortunately, in 2023, because of ease of convenience, refrigerator diet, fast food available everywhere, we are, as a population, consuming just overprocessed food, refrigerator food, and we are not getting enough natural fibers, good fibers. We're not drinking enough water. Our vitamin D levels are extremely low. All of these things contribute to delayed transit constipation. So it's very, very important that before surgery, we optimize all of those things, because post-surgery, you're getting medications, you're getting sedation that can slow the movement of GI tract, or you may be getting exposed to antibiotics for a little bit of time that may affect the gut microbiome. And then, of course, the movement post-surgery is a bit limited as you recover, and narcotics for pain relief, all those things can worsen the pre-existing constipation. So it's very, very important to have good, healthy diet, good fiber, 92 ounces of water daily, at least, 8 to 10,000 steps a day at minimum is a very good physical activity goal. If you can't do anything else, if you can't hit the gym, at least 8 to 10,000 steps a day is minimum and very, very good for overall colon transit.
92 ounces of water? That's a lot of water.
It is a lot of water, and that just tells you how much we are under drinking. But that's the recommendation, 92 ounces of water in any otherwise healthy person. That's what it takes to have good hydration, good skin health, good colon, GI health.
Well, it's true for the skin too, because if you are dehydrated, it shows up on your skin, and I think that contributes to the aging process. Another thing you had mentioned in some of the things we had talked about before as we prepared for this podcast was a FODMAP diet. What is that?
Yes. Thanks for bringing that up. So FODMAP diet refers to fermentable gas-producing food ingredients. So it's very important. So FODMAP diet that's rich in FODMAP can lead to bloating as well. So it consists of oligosaccharides, which are found in wheat, onion, garlic. The D of FODMAP stands for disaccharides like lactose products, milk, cheese, yogurt. M stands for monosaccharides. Like monosaccharides are a type of sugar that include fructose, and that's commonly found in fruits and honey. And then you have polyols, which are another type of sugars that are less commonly found, but they're found in fruits like nectarines or apricots or plums or cauliflower are the most common. But there are different type of molecules that are found in different food types. And these food types, more than others, lead to fermentable, they're considered fermentable foods and can produce excessive gas and lead to bloating. And very commonly, these are the foods that we want to try to avoid or limit. That's kind of the first step if we think that the bloating is caused or related by food intake. So a diet that is low in FODMAP is usually very good for relieving bloating initially. And one more thing. Yeah. I would like to say this diet is extremely hard to follow. So what I tell patients is I give them a handout that talks about all the foods that fit into this category. And I tell them, pick your top 5 foods. Keep a food symptom diary. And that's how we are able to delineate what are the top 5 food triggers for you. Because what's sustainable, lifelong, or in a long period is if they are able to figure out their triggers. The goal is not to eliminate all the foods, because that's not sustainable.
I think that's a really good point. And I don't know how you think about it, but the way I think about it is I think that just everybody is unique, and everybody will find a diet that works well for them, because there are going to be certain foods for different people. Like I don't do dairy or rarely, because I know it makes me feel bloated. I can't do rice because of the same reason, but I'm sure for other people that may be different. Is that fair to say?
Exactly. It's very fair to say. And that is exactly the point. And I think a lot of times we miss that point that, we recommend, hey, low FODMAP diet, without realizing that's just not idealistic to expect somebody to eliminate 32 different types of foods in a busy life. So it's all about individualized plan, and it's all about empowering people to know what works for them, what are their triggers, and that this could be a lifelong thing. But as long as you know your triggers, whether it's dehydration, whether it's certain foods, whether it's constipation, or whether it's stress-related behaviors, that, okay, I can manage it because I have this education and I feel empowered to know what works with my body. And I think that's the key, the individualized plan, both in food and figuring out the triggers.
So what I'm hearing is, number 1, walk 10,000 steps a day. Number 2, drink lots of water. And when we're talking about hydration, we're talking about water, not things like coffee and alcohol and all that stuff dehydrates you. Yes. And then also work towards finding what foods are your triggers, are your unique triggers, because you're not going to be like your best friend. He may have different triggers. So it's important to respect your individuality. Is that fair to say?
100%. You hit it out of the park right there. And the last thing I would say is hydration doesn't mean carbonated drinks. That can worsen the bloating. And I wanted to make it a point to say that. So we're not talking about drink soda, 92 ounces of soda. That's actually going to be counterproductive. It's absolutely water and not also caffeine drinks.
That's awesome. Thank you, Dr. Singhal. It was great to talk to you this morning.
Thank you. Thank you for having me. I appreciate it.
If you would like to schedule an appointment with one of these physicians, here is their office contact information. Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please check back often, as we will be constantly adding new content. If you have any questions or particular subjects you would like us to address, please email us at she@shetv.com.